Welcome, everybody. My name is Dr. Liana Lianov, and I'm the president of the Global Positive Health Institute. Welcome to our podcast video series that explores all aspects of positive psychology, health and well-being, healthy lifestyles, lifestyle medicine, and more. And today I'm delighted to have as our guest Dr. John Chuck. He's a family physician and the former chair of wellness for the Permanente Medical Group. Welcome, John.
It's great to be here, and thanks for having me.
Terrific. And so we keep these short and sweet. We're going to dive right in. Just share with us what interested you in physician and health professional well-being.
Well, I knew from my early college years that I wanted to be a doctor, and some of my role models were uncles who were physicians. And I saw that they had issues with work-life balance. They were so often away from home, yet they had children and things, and it was a challenge. So when I started my career, we had a young family, and I was intentionally trying to balance my work and my family life so that I could enjoy both. And I remember that within the first few years of my career working at Kaiser Permanente, I did a survey through the local medical society and generated some data and published an article in the Western Journal of Medicine called "Is Being a Doctor Still Fun?" So when people ask me, what were the earliest signs that you're somewhat interested in physician well-being in an organized way, I sort of point to that article. And it's not like I was thinking, I want to be a leader in physician wellness. I was just trying to figure out my own life and to make sure that I could have a balanced one. So that probably is the earliest sign that this is a field that I would work in later in life.
Yeah, through that article, you were thinking out loud for yourself and sharing with others.
Exactly.
And so then you dove into this area over time. And what have you discovered are effective and interesting interventions to really promote our physician and health professional well-being?
I think what I've discovered is that there's no one answer that can help physicians be well. It's one of those issues that's actually very complicated. So I try and avoid the soundbite or the social media image or quip that just, captures it all. And I invite people to think broadly about the topic, because I think anything short of that is a real disservice to the individual and the institution and society. So I really like, the Tate Shanafelt framework of the reciprocal domains of wellness, because it really summarizes what I feel to be are the important domains. So of course there are all the personal resilience habits that we all know about, and all the early work in physician wellness centered on that. But if you have inefficient operations, you won't be well, and if you have a toxic culture, you won't be well. So I do think that culture, operations, and personal resilience habits, sort of includes all the things we need to work on to help us have long and sustainable, enjoyable careers.
That totally makes sense from a big picture perspective, kind of how to frame things. And then to do a little deeper dive with the Global Positive Health Institute, we are looking to get into the nuts and bolts of effective individual approaches. It can be easy to say, get a little exercise, et cetera, et cetera. We know there are time factors and many other pressures that may or may not help us. And then on top of that, really the traditional healthy lifestyles are oftentimes not effective because they're maybe either not intensive enough or not framed and we have at the Global Positive Health Institute a bias, but backed up by science, that there is a role for positive emotions and positive activities to be foundational to healthy lifestyles, and that sometimes takes a little extra time and sometimes not, but we're building a picture of total well-being that's a comprehensive healthy lifestyle that includes these more fun activities.
Right.
But there is this balance between that and, of course, needing organizational change. So I'd love to hear your thoughts about this balance and how we get our colleagues to not push back on those individual approaches, but embrace them in ways that are useful to them. And so, yeah, take it away.
Right. So I do think that within an organization, the executive leaders need to give people the roadmap for where we're going on this physician wellness journey. And how do you balance the personal wellness of physicians with the organization meeting the patient care needs, right? So executive leadership needs to say, this is the big picture. We are working to improve the culture. We're going to make it a psychologically safe place to work. We're going to measure wellness. Okay, so that's the culture thing. And then we've got the operations. We understand that these are the issues, these are the stumbling blocks, the pebbles in your shoes to efficient operations. We're working on these X, Y, and Z things. And then, getting to what you're interested in, and I'm very interested in positive psychology, you have to look at individual physicians and say, okay, so if you want some solid suggestions, pick from this menu. And it would be stay physically active, eat healthy food, and be mindful, okay? And I think that for the individual, really pushing mindfulness is great. Mindfulness is a practice that people of any faith or no faith can all adopt because it's not a religion, okay? And it's this lovely practice of just being fully present in the moment, because the present moment provides plenty of challenges for us. And don't worry about the past, don't be anxious about the future. And because I think that being mindful sets you up for three ways of thinking that can help you sustain a great career. And they are gratitude, service, and believing that your sustainable best is by definition the best you can do. So can I just talk about those three things just with some little stories? So gratitude. My late father was a minister, and he took care of a lot of sick people, shepherded a church family for over 4 decades in the middle of San Francisco's Chinatown. And he always told me, John, you should be grateful every morning that you can wake up and pee. And he told me that when I was in junior high, and I'm thinking, who's this crazy man? Why is he saying this to me? But of course, as I went to medical school and residency, I realized, wow, what my dad was saying is that the human body is a very delicate thing. A lot of things can go wrong. How can you not be grateful that you wake up every day? I mean, you obviously could have died in your sleep. How can you not be grateful that you can pee and poop on your own terms? So I would say start out each day with a position of gratitude. And another thing my dad would say is, you should be grateful for meaningful work and the strength to do it. So that's another thing. I start out each day saying, wow, how fortunate am I that I actually have the privilege of meaningful work. And for one more day, I have the strength to do it. So that's great, right? And then, we head off to work, and there are a lot of ways you can think about it, like, oh, geez, I have to go fix these people. I need to help these needy people. But I tend to go to work each day saying, I'm going there to be of service to these people, like a great server in a restaurant, or in the old days, the gas station attendants. They're just there to serve you. And so I just go to work saying, I'm here to serve people, help, serve people. And if I can do that, I've had a great day. And then the last thing, the big picture thing I think about is, I truly believe in my heart that my sustainable best in my workplace, in my family, whatever, that's by definition is the best I can do. And I love myself and honor myself and respect myself for doing that. Because so many people have somehow these weird, perverse standards of what makes a good day or what makes them worthy. I'm just thinking the best I do is good, right? So that's good. And you're a big fan of all the positive psychology, as am I, the Barbara Fredrickson, the Dr. Keltner, the Kelly McGonigal, the Bob Emmons. Well, why is it so important to be aware of the negative, but focus on the positive? It's kind of like the Viktor Frankl thing in Man's Search for Meaning. He goes, yeah, he survives 4 concentration camps. Yeah, he could focus on the negative, and living that experience, it's natural to focus on the negative, but he says you have to force yourself to see the positive and to hang on to hope, because his observation was that those who dwelled on the negative and lost hope, they literally died. All right. And so what's happening in American medicine? I mean, we're aware of all the negative things, and if you focus on them, and that's the main reality of your life, you're going to hate it. you're going to be disengaged, you'll be unhappy, you'll burn out, you'll probably leave the profession or just be a very grumpy doctor. So I think there's so much to be said for being aware of the negative, work on it, try and make it better, try and eliminate unnecessary suffering, and then focus on the positive, because you don't have a whole lot of time to do it. You know, you blink and you'll be dead. So do it now.
Well, and we are wired, and probably many folks in the audience have heard this, but we are neurologically wired for a certain stickiness to the negative and the negative emotions, because it comes from that basic survival instinct.
The whole
so
frog brain.
Yes, and so it does take effort to shift towards a more positive perspective. But that does lead me to make the comment that lately there's been this term thrown around called positivity toxicity, right? Where people are like, oh, you're forcing me to be positive. There's just all this stuff going on in my life that just it doesn't feel natural. And so I said, especially because they're thinking that with positive psychology, that we're saying, okay, just, only be positive, only focus on the positive. And I say, no, actually, even in the field of positive psychology, there is a construct called emo-diversity that we embrace, which is the diversity of emotions. It's important. It's part of being human. We embrace them with self-compassion and allow ourselves to feel what we're feeling, but then not dwell on them, like to your point, and in a kind and gentle way for ourselves and hopefully others around us, shift towards something that really will boost us up and ultimately be more productive and effective for us, and again, those around us, including our patients.
Well, I completely agree with that. And I would say that my positivity is deeply, deeply rooted in negativity. And here's an example of that. So I went to Lowell High School in San Francisco, big public high school, graduating class of 850 people. And I was voted the most positive person, optimistic person in my graduating class. And you would think that, oh, it's probably because he was a naive 17 or 18-year-old. But it's the exact opposite. So I grew up, in Chinatown, moved out to the Sunset. San Francisco is not an easy place to grow up unless you're super wealthy. Okay, it's very dense, a lot of public transportation, a lot of crime, and I had some family members get mixed up in that. My good friend Calvin Fong, who I went to church with, and would often socialize with. He was murdered in the Golden Dragon Massacre, when in high school, and that massacre occurred 2 blocks down from the church where my father was a minister. And so my understanding of life was that it's very difficult. And I said to myself, if this is the way life is and the way life is going to be and the way it always has been, I am going to be one of the people in the world who chooses to focus on the positive and try and make something better of this world. I'm going to be one of the people that tries to, harness entropy and bring some order to chaos. So my optimism and focus on gratitude and positivity is not rooted in being naive. It's rooted in my understanding that the human experience is full of pain and suffering. And you only have so much time to try and make something good of it.
Yeah, absolutely. Yeah. And I'm sorry to hear that story.
It's tragic. It's tragic, but it certainly wasn't exclusive to our experience in San Francisco. You can look in any community, look at any chapter in the history of mankind, look at the massive world wars. I mean, this is just human nature. It's us versus nature. It's us versus one another. This is who we are as human beings. And I think that you could choose to be resigned with that. Like, well, I can't do anything about that. Or it's like, nah, in the one life I have, I might try and dare to change the trajectory of where we would otherwise go. And I don't want to get to the end of my life thinking I never tried to change that trajectory, right? In the one life I have to live, I'm going to try and make something of it for myself and for those around me. Why not?
So you're really talking about meaning, which is one of the most robust elements of the general positive psychology approach, is that that eudaimonia and the positive emotions that come from eudaimonia, or a sense of meaning, is so powerful, and there's evidence that is directly related to our health and well-being and our longevity. And you, it sounds like you're very rooted in that, so you're going to live to be 120.
Well, it's interesting. Here I was leading wellness for 10,000 physicians, thought I was doing a really good job, but I was always learning. And deep into my leadership career in wellness, I had the privilege of attending Rachel Remen's 2.5-day course in Yellow Springs, Ohio. And, what Dr. Remen says, and it was really illuminating for me, where she says, meaning is the deep satisfaction of knowing that your existence matters, and that what you're doing with your life makes a positive difference in the lives of others. And I thought, yeah, I want that, right? And I want that. I want to know that my existence matters, and that what I'm thinking and what I'm doing and the change that I'm trying to make in the world is having a positive influence on others. And it also makes me think about my daughter's high school graduation, where the faculty speaker, he said, my only hope for all of you graduates is that at some point in your life, you would have the opportunity to work with other people for a cause greater than yourself. Basically planting the seed in these young minds that, it's great to pursue individual achievement and to learn things so that you can be a productive person, but ultimately the whole purpose of developing yourself as an individual is so that you can contribute to a team that's doing work that's much bigger than yourself, right? Like, yeah, is it great, to win a lot of awards and to do a startup company and to get rich? Yeah, that's great. But did you use your talent to help the world, or was it just to help yourself? And my observation as a family doctor for over 3 decades is that the patients who got to the end of their life really satisfied were those who had done big work to help other people, right? So, and I'm sure you saw that in your practice too. So that's what it's about.
Yeah, it's interesting because what you're also talking about, we're talking about meaning, but we're also, as you just said, it's connected to others. So relationships and our social connectivity, whether it's in a broad sense, or with family members and friends, or perhaps in some cases, there's even evidence just in having that kind, authentic interchange with strangers. Over time, we have hundreds of those kinds of interactions, sometimes in a day, and certainly over a lifetime, many thousands. And the more really good connections, and perhaps meaningful connection, meaningful even in that I'm smiling, I'm helping the other person smile, I'm making a better day for them, adds to our health and well-being and longevity. And that is probably the most robust component of what we call positive psychology interventions. And so that leads me to a question about, we've been talking about a number of ways to promote and support well-being. Do you have a favorite for yourself, or anything that you would like?
Well, I mean, for myself, and I think for many people, I think that cultivating a good mindfulness practice is probably one of the most important things you can do. And, I had the benefit of inviting many great mindfulness instructors to our group. And of course, I would sit in on all the courses. So I got 10 times the instruction that most people got. But I feel like over the past 15 years, I've generated a very a healthy and robust and resilient mindfulness practice. I think it's how I was inclined to think, but after going through formal training, it's just part of who I am. I really, like for instance, right now, I'm only thinking about this great conversation we're having, and to be fully present in this moment, and to be able to listen and generously to all the things you're saying, and not thinking 10 minutes ahead to what am I going to say later that will make me look really smart. I don't really care. I'm just I'm just like in this moment with you right now. And once again, because I know many people come to the medical profession with different, faith beliefs. I like mindfulness because you can be Buddhist, agnostic, Catholic, Protestant, Jewish, Hindu, whatever. Anybody can be mindful. It's not asking you to put aside any previous belief systems you have. It's just asking you to slow down
Yeah,
and
exactly.
to make better decisions in response to your circumstances. And once again, Viktor Frankl said, the only he goes, we have to be responsible to our circumstances. Like be an adult, make good decisions about how you're going to respond to a stress and attention. And because of all the great positive psychology work that you're doing and promoting, people have a large menu of things to choose from when deciding how to respond to a busy day, bad news from your boss, a colleague giving you a bad peer review. I mean, there are so many dysfunctional ways, so many frog brain ways to respond to those things. And we naturally do. They say our minds are like Velcro for bad news and Teflon for the good. But, we can choose positive psychology. We can choose gratitude. We can choose awe. We can focus on, adaptive perspectives to number one, just keep us in the game. And then if you can cultivate that practice, then you can kind of move on to not just staying in the game, but enjoying being in the game. I would say that the other wellness intervention that I'm becoming a bigger fan of, because it takes a long time for systems to change, it takes a long time for culture to improve and for operations to get more efficient. I'm a big fan of the remote immersive wellness experience. There's a group of people at 1440 Multiversity in Scotts Valley, the Krenz family, just super generous and kind philanthropic couple, but they're inviting healthcare professionals in groups of 50 to this 2.5-day experience called Healing Our Healthcare Heroes. And they basically immerse doctors and nurses and respiratory therapists and people in this unconditional love for 2.5 days in the redwoods to let these people reconnect with feeling human again. And in that environment, they begin to be friendly to revisiting their original motivation for becoming a healer. They begin to reconnect with the fact that they are healers and are being of service to others. And it doesn't, fix them, quote unquote, fix them, but it just gives them the space and the unconditional love to say, you know what, maybe I am in the right profession. I just really need a breather and time to step back and think and be, because that's not, that's not the privilege we have in a day-to-day medical career. It's just so busy. So sometimes you need to be able to step back. And reframe.
Step back and reframe. So that kind of reboot, like rebooting a computer, is definitely useful. But then again, I think you would agree that there are these tiny moment to moment, and you were talking about that redirection of our attention, which is very healthy and very useful to be present in the moment. And we don't have to use even the word mindfulness, and certainly it's not meditation or any of those, because sometimes there are connotations with that, and some people push back and think, oh yeah, that's not for me, or that takes even too much time, or it's something I don't believe in for whatever reason. And so we can just let go of all of that and just connect on that human level, that just being aware in the present moment of what's enjoyable. And it might be as simple as I used to counsel pain patients, and sometimes just redirecting them from attention to their pain to attention to how cool the seat feels against their bottom when they're sitting down. And just that lovely sensation can help redirect even while they're doing something else. And all of us in the moment, no matter what is going on, and as busy clinicians, lots of patients running around, lots going on, there may not be those moments. We hope at least a moment here and there to kind of take a little breather. But even as we're rushing about our day, that constant refocusing on what's good in the moment, physically, emotionally, can go a long ways. And that's a huge boost to well-being.
Yeah, and I think the really encouraging news is that when you first learn, I don't mind calling it a mindful practice. I mean, I just think of mindfulness as John Kabat-Zinn's secular pullout of Eastern meditative practices. I just feel like it's a thing, right? It's a pretty clean thing, right? So yeah, you know, when you're first learning how to live like that, yeah, it helps to go to a 4-hour retreat or whatever. But I got to the point where it truly became a habit, and that I could recenter myself in the middle of a super busy 14, 16-hour day. And here's a little practice I would have. As I approached the patient room, when my hand touched the doorknob, I always said to myself, you know, I'm grateful for meaningful work and the strength to do it. And I'm saying it to myself as I'm turning the handle and opening the door. So it's not like I'm losing any time, right? And another thing I would say to myself is, you know, let me be of service to this person today, right? Like those are super simple ways to just, you know, it's like a little mantra. You just kind of reground yourself before every encounter. And those things really work. You know, it really works. And it takes, I mean, it takes time to practice it, but once it's part of what you do, it literally takes no time off the clock, right?
Yeah, exactly.
And then it makes each sequential encounter better. And it makes me not think about the last encounter. It makes me not worry about the next encounter. It just brings me right in. And the patients can feel that, you know?
Sure.
And that's how you, even if the culture doesn't get better at all and the operations stay inefficient, the beautiful thing about mindfulness is that the external environment doesn't have to change at all, because it's really about, you know, what you're changing internally. And I think that wellness and the perception of wellness, it's mostly an internal experience. We were talking about the power of connection earlier, and Richard Swenson, a family doctor, wrote a great book called Restoring Margin to Overloaded Lives, because, you know, that's what we have, right? It's overloaded lives. And he said that all wellness in life comes from connections. And of course, they're the connections that we know about with others. He calls that your social life, your professional life, whatever. It's just with others, right? External. But then he said there's the connection you have with yourself. And he calls that relationship your emotional life. What a wonderful definition of your emotional life. It's your relationship with yourself. It's the story you tell yourself about yourself. And a positive story would be, I'm one in a long line of healers. I'm here to heal people. My dad was a minister. My mom was a nurse. I went into medicine to be a healer. And I want to bring the best of what my father was and what my mother was to my patient encounters, right? And then he says, the last type of relationship you have that brings you wellness is your relationship with God or a greater spiritual being. I would say that for every human being, including healthcare professionals, if you're feeling unwell and disconnected, intentionally connect with others, yourself, and God, and you'll enjoy your life better. Get reconnected, right? And make that the top priority. You know, if you're multitasking, let go of all the extraneous stuff that's not making you more well. You know, the pursuit of material things, the pursuit of recognition, the pursuit of another certificate or award. I'm just telling you, as a 61-year-old guy, that is not going to be what leads to you enjoying your work more or being happier or being more fulfilled on your deathbed. That it's just not it. If it were it, I would tell you that, okay? But that's not what I see in my own life. It's definitely not what I saw in all my patients' lives at the end of their lives. Never, ever, ever had a patient say, I wish I'd worked harder, gotten more awards, or, I would have been happier if people told me. No, it's like all the happy people are the ones who invested in meaningful relationships, right? That was it. And work that was bigger than themselves. Those are the two things: meaningful relationships, meaningful work. That's the ticket.
Well said. Well, we're coming to the end of our podcast. So as we wrap up, I would love to ask you, what are some great resources that you can recommend to our listeners, and any other parting thoughts?
Yeah, check out the Greater Good Science Center. Like a largely UC Berkeley based group. I think their website's wonderful. So much of the information is free. They offer workshops. I'm a big fan. Dr. Keltner is, we often invited him to our wellness events at Permanente Medicine. He's actually a super smart person who's trying to help the world. Like largely a selfless person trying to help the world. So Greater Good Science Center. And if you're looking for an immersive experience for you and your team, I would look at 1440 Multiversity in Scotts Valley. So those two simple suggestions, check them both out.
All right. Well, thank you so much for joining us for this series. And any last words of wisdom?
Okay. It's not a word of wisdom, but sometimes people say, oh yeah, I'd like to find out more about that. So when I retired from the Permanente Medical Group in 2020, I spent 6 months writing a book that included all the best things that I knew about wellness. And so I wrote a book called Pearls from the Practice of Life, A Family Physician's Guide to Struggle Less and Thrive More. And you can buy it on Amazon. So I guess that's my last word of wisdom. If you want to read 69 chapters of wisdom that I've gleaned from the world, you can find it on Amazon. Pearls from the Practice of Life.
I'll get that. That sounds exactly what so many of us need. And again, thank you so much for joining us, and perhaps we'll bring you back again as the work of the Global Positive Health Institute evolves. We'll do a deeper dive on how to promote well-being for ourselves and our patients. So, and thank you, our listeners and audience, for following our Global Positive Health Institute. Please subscribe for more of these lightning discussions on positive psychology, health and well-being, and more. Take care, everybody. Bye-bye.